Good morning and welcome to the Insight and ABSAD webinar series. I'd like to begin by acknowledging the traditional owners and custodians of the land on which this event takes place and pay my respects to elders past and present. I'm coming to you today from Meanjin on the lands of the Turrbal and Yagara people. I would also like to extend that acknowledgement to any Aboriginal and Torres Strait Islander peoples who are joining us today across the web. My name is Imogen Malone and I am the Aboriginal and Torres Strait Islander AOD educator here at Insight, and I have the pleasure of facilitating today's webinar, Improving Culturally Responsive Practice with Aboriginal and Torres Strait Islander people attending mainstream drug and alcohol services. Our presenters today are Dr. Sara Farnbach and Raechel Wallace. Sara is the program lead of the RISE team, which stands for Research, Innovate, Strengthen and Embed at the National Drug and Alcohol Research Centre, known as NDARC, in the University of New South Wales. Her research is focused on preventing harms from alcohol and other drugs in rural and regional New South Wales and working collaboratively with communities to tailor health services and strategies to suit their setting. Raechel Wallace is a proud First Nations woman from Wondiwondian and Wadi Wadi country within the Yuin Nation. She has been working in the Aboriginal alcohol and other drug sector for almost 20 years. She is currently working as the Senior Research Officer at NDARC and as an Aboriginal Program Manager for the Network of Drug and Alcohol Agencies, NADA. She is also a Director on the Aboriginal Corporation Drug and Alcohol Network of New South Wales. Without further ado, here we go.
I'd first like to start by acknowledging the traditional owners of the land where everyone is meeting today. I'd like to pay my respects to the elders past and present. I'd like to extend my acknowledgement to any First Nations people who are joining us today. I'm a proud Wadi Wadi woman from Yuin Nation on the south coast of New South Wales. So a little bit of background about the project, but first I'd like to acknowledge that our Aboriginal community-controlled health organisations are the best placed services to provide culturally safe services to Aboriginal people. But the reason behind this project was not all Aboriginal people access Aboriginal services, and there's many reasons, and they vary. So the reason for this project is so if an Aboriginal person accesses a mainstream drug and alcohol service, they can access that service and feel culturally safe and respected. We know there's reports of race, Aboriginal people experience racism in the health system. So I think this is a really important project to support our mob in accessing services. So how we did this project, we first started by, this project's based in New South Wales, so we did consultations across the state, and this included, I consulted with elders groups, I consulted with Aboriginal people who was accessing mainstream drug and alcohol services and finding out from them what they feel services could do to provide culturally safe care. I also spoke with Aboriginal drug and alcohol workers, community members. We did a pretty big, extensive consultation across the state. So we also did a literature review, and there's a lot of literature out there about this. There's a lot more, I found a lot more in the family and community services, but I didn't find much on drug and alcohol services. How we done the project was, so from the consultations, from what we found in the literature, also my experience in working in this sector for so long, so I've got an ACHO background and I also work in the NGO sector. So putting that all together, we developed a guideline. So what's different about this project is that we developed a workshop to go along with the guideline, because many times we get guidelines and they go on the shelf and they look really pretty and that's where they stay. So I really thought it was important to include a workshop. So how we done the project was we went in and we done an audit on the service based on the areas that were in the guideline, and then we went back in 2 weeks, we did a workshop, and based on their report from their first audit, we did they got their report back, and we supported services to work on areas where they thought that their services needed more help in. There was 5 non-Aboriginal services across New South Wales who voluntarily put their hand up to participate in this project. So the principles, so it was around choice of services for Aboriginal people and respect. and person-centred care, because some of our clients in the drug and alcohol sector, there's a lot of things going on. So just making sure that you provide person-centred care to address the issues and other issues underlying. So we developed 6 themes for the guidelines. So as you can see, it starts with creating a welcome environment, and that's the first point of call for an Aboriginal person to access a service and service delivery, voice of the community, engagement with Aboriginal workers and services, capable staff, then organisational responsibility. I'll elaborate more on the themes later on in the presentation. These were across the state. These were where the services were based. The ones that are in the brown area, the services there were services that would cover all that brown area, so they would outreach out to Western New South Wales. And we had different types of services who put their hands up. So residential rehabs, day programs, youth services, community-based services. So they're all different. So when we did the project, they kind of all had different kind of needs they wanted support with through the project. I'll hand over to Sarah.
Thank you, Raechel. Good morning, everybody. Very nice to be here. From the NDARC side, we were asked to come in and work with Raechel and her team around doing an evaluation of the project. And so we worked together in pretty close partnership over the lifespan of the project to set up an evaluation framework to see how the implementation process went, and then also measure the impact of the project on services. So we thought up what would be interesting for us to look at as part of this evaluation, and we set out to really look at 3 key aims. So the first one is around fidelity. So was the project completed in full? And I'll talk you through how we measured that in a moment, but this was looking at the extent to which each of the components of the project were actually implemented at services. The second one was around acceptability. This was new. We were coming in with this new guideline and this new implementation process that Raechel's described. And so was that acceptable to staff? How did they receive the project? What did they think about the process that we were proposing? And then finally, we wanted to look at impact. So this was looking at, did the project in fact shift cultural competence in these services, and to what extent? And also, did that then change the way services were used by Aboriginal people during the project lifespan? So it was a pretty ambitious approach, but nonetheless, we gave it a go. So to answer these questions, we used various data sets, including interviews with staff and CEOs of the services. And we also used quantitative data where we measured and scored the audits that Raechel mentioned, as well as using the minimum data set for drug and alcohol services. And we completed some surveys as well. Okay, so here's a quick overview of the activities of the project. As you can see over to the left, as Raechel mentioned, the first step was to develop that guideline, the best practice guideline that Raechel and her team developed through the consultation process and led by the Aboriginal Advisory Group. From there, we developed an audit tool, which allowed Raechel and her team to go into the services and conduct sort of an assessment of cultural competence activities within services. And then we implemented the audit tool within each service. So we did we called it a baseline assessment, or audit 1. And from there, as Raechel mentioned, we came back a couple of weeks later and worked with services to develop a tailored implementation plan for their service based on their audit findings and on the guideline. We then let them implement that for a period of time and came back and did another audit 2 at about 3 months, and then another audit at 2 years as well. So each service went through 3 audits. So to give you a sense of what the evaluation framework looked like, we designed a step wedge evaluation where we organised the 15 services by kind of geographic cluster, and we grouped them together, and then we randomised them to start time. And then we rolled out this implementation process that I just described in each of the services over a series of months. So each service received all of the activities, but in a stepped kind of way, as you can see here in this picture. So we ended up with 6 services with varying numbers of, 6 clusters with varying numbers of services in each cluster. Okay, so was the project completed in full? So this is our first aim for the evaluation. So this slide shows the completion rate of the various components of each step of the process within services. As you can see on the left, we started with 15 services at the beginning. We had 12 complete audit 1, and then we had we had 14 complete audit 1, 13 attend the workshops, and 12 complete audit 2. So you can see we sort of stepped down. We lost 1 service at each step, and finally we had 11 at the end of the project who completed all of the steps of the project and also consented for us to examine the minimum data set data arising from their service. So we thought this was pretty good, considering this all happened over COVID and there was a whole range of things happening for services. A pretty good retention. It really demonstrates that there was a firm commitment and interest from these services in working to improve cultural competence within their work. Okay, so acceptability. So when we conducted interviews with staff of the participating services, most staff reported that the project was highly acceptable. They got a lot out of doing the audits and also the implementation workshop. So that opportunity to sit and talk with Raechel and her team about the guideline and about how it might be implemented within their services, both through the audit discussion at the beginning and then through the planning session as part of the implementation workshop, was seen as really beneficial for staff. They reported to us that they learned a lot, and just having that time and space to sit and think through what implementation might be like within their setting was of great benefit. I've got some quotes here. I won't read them. You can all read. But you can see that staff are really immediately started feeling the impacts of being involved with the project. So that was great. Staff reported to us that their skills were built during the project. They felt that their capacity around cultural competence was developed as well. And that just that experience of going through doing the audits really prompted change for them. Okay, so acceptability of the workshop. So these were the implementation workshops that Raechel and her team ran with the services after they'd completed audit 1. At the end of the day, we asked them to do an anonymous online survey to tell us how how their experiences of completing the workshop was. And as you can see, on the whole, acceptability was really high. Staff reported that the processes around the workshop, so the logistics and the planning, were really well organised. The satisfaction on the bottom left was reported to be very high, as well as the acceptability of the workshop in terms of whether the aims were explained clearly, whether activities worked well, and whether they benefited from the workshop. So overall, I think we can say that the workshops were highly acceptable to staff. Okay, so here we go to the impact on cultural competence and on service delivery, our third aim. Initially, during the implementation workshops, service staff selected 3 key action areas or 3 key activities that they wanted to focus on during the next phase of the project. As Raechel described earlier, the guideline was vast and covered a lot of areas, and so we thought it was probably unreasonable to try and expect change in all of the areas of the guideline all at once. And so by selecting 3 activities, we thought it might focus their activities a little bit and give them some tangible steps to start with quite quickly. So here what we've got is the audit findings from these 3 key action areas that each of the services selected. They also selected a range of different actions that they wanted to complete that aligned with different parts of the guideline. So as you can see, from audit 1 to 2, 10 out of the 12 services that completed both of those audits increased in their 3 key areas, and 2 had no change. And between audit 2 and 3, 7 out of the 11 services increased. 2 had no change, and 2 decreased. The services here, this is a little bit complicated, I know this slide, but the services here are organised by cluster. We've got our 6 clusters, and then we've got our baseline, audit 2 and audit 3 assessment along the bottom. So the general trend is kind of going up, demonstrating an increase. On average, audit ratings increased by 3.7 points out of a possible 9 points in the audit score between baseline to audit 3. And it was a statistically significant increase, which shows that across all the services, a number of new activities relating to cultural competence were implemented by services. So we're really happy with that. Oh, sorry, I forgot my little red arrows. Okay, so this is just to give you a reminder. So this was looking at audit 1 and then audit 2 and audit 3 findings all together. Okay, so we also assess change in audit scores in all of the action areas. So that previous one was just looking at the 3 key areas that they wanted to focus, but the audits completed baseline, audit 2 and audit 3 looked at the whole guideline. And so looking at activities relating to cultural competence across the 6 themes. So this slide is presenting the whole guideline audits. And again, you can see similarly, services, generally the trend was going up. And there was an average increase in audit scores from baseline to audit 3 of 14.8 points in the audit score out of a possible 54 points. Okay, so this is when we started to look at the MDS data for all of the 11 services who participated and consented to have aggregated de-identified data included and analysed for the project. So we wanted to see, did these increases in cultural competence shift the way services were used by Aboriginal and Torres Strait Islander people during the course of the project? So after 2 years across all the services, unfortunately, we found no statistically significant changes in any of our outcomes. So these included the proportion of episodes of care provided to Aboriginal relative to non-Aboriginal people, the number of episodes of care provided to Aboriginal clients, and the proportion of completed episodes of care by Aboriginal clients. So you can see we sort of designed some outcomes that we thought we might see some shifts in if people's experiences were improved, we might see different types of service use patterns. But unfortunately, we didn't see any improvements during this time. As you can see here, so this is, again, I've just provided you just to give you some context, but each of the services are one of the coloured lines, and you can see it's just sort of all over the place. It's a bit messy, but essentially what we've got here is the data. This is the proportion of proportion of episodes of care provided from March 2019 to September 2021. So this is over the course of the project. And the dotted line is when the implementation, the baseline audit and the implementation workshops occurred. So although they weren't statistically significant, we think it was useful in that it demonstrated that it's possible to use data in this way in an almost real-time sense. We analysed the data quite quickly, and we were able to provide this feedback to services within a short period of time after the project completion. So I think this analysis demonstrates that we can use routinely collected administrative data to evaluate the impact of these types of initiatives within services. As the graphs demonstrate, we can show trends and changes over time, which is, often not possible. And, if we were doing this as collecting these data as a separate part of a research project, it would be really cumbersome. So what does this lack of statistically significance mean? There's possible explanations that we could talk about all day, but perhaps these improvements in cultural competence don't actually translate to changes in service use. Maybe it takes more time for these benefits in cultural competence changes to flow on to service use. We know that this reputation and this kind of vouching for services takes time to occur within communities, and so maybe our project timeline was too short. Maybe the outcomes that we were looking at weren't quite right. You know, we looked at service completion and proportion of service use. Maybe we're looking at the wrong thing. But, you know, this is all a watch this space for the next phase of the project, I guess. You know, there's space, obviously, to look at other types of experiences of Aboriginal clients coming through as services as well. Perhaps looking at things like we've identified here on the slide that patient-reported experience or outcome measures might be a different way of identifying change as a result from changes to service delivery. Anyway, we're not sure, but nonetheless. Okay, so I'm just going to hand over to Raechel now, who's going to talk a little bit about each of the themes and give you an example of what activities were undertaken as part of the 6 themes throughout the project. So over to you, Rach.
Thanks, Sarah. So theme 1 is like creating a welcome environment. This is the first point of call for an Aboriginal person when they enter your service. So how you do this right. So it's kind of like the environment, how Aboriginal people are welcomed into the service. When I did the consultations, I just one auntie's comment stuck with me, like, and it's still today, is like, she said to me, when I go into a service, she goes, straight away, I know how the receptionist feels about me. She goes, and she can sense the racism. So this is why this is so important, because if an Aboriginal person comes into your service, you do not want them to feel like that. Also, don't have a tokenistic welcome environment. So it's kind of making your space feel culturally safe. So that would lead to some consultation with your local community on how to do that. Also, is your area kind of family safe, because some Aboriginal people, if they're coming into your service, they may bring a family member, they may have their children with them. There's many things. So the service delivery, this is how you deliver your service and how flexible you are with your service. Where do you meet your clients? I said that one already, how do you deliver your service? But, you know, like meeting Aboriginal people where they want to meet, where they feel more safe. What tools do you kind of use when you're working with them? Also referrals. So if someone's coming to your service, and I know our drug and alcohol services are not crisis services, but if an Aboriginal person's come into your service and is seeking support, how quickly do you respond to them? Because when they're coming into your service, that may be the time where you can actually, it's an opportunity to provide services to them. So that's really important. Yeah, and I mentioned the tools. So I'm sitting off my chair. So voice of the community. So you want to work well with Aboriginal people, develop relationships in the community, and like with community, this is not the service delivery. So getting to know your community, I think it's really important you get to know the local history and the protocols of your community if you want to work better in this space. Because you might run a group and you might run this group in a building where it's got bad history for Aboriginal people. So we're not going to show up. We're not going to attend that. So just knowing the community. So engagement with Aboriginal organisations and workers. Now, this is really important. So creating these relationships. Some of our ARCHO services do not have all the services that, you know, the drug and alcohol sector has. So building partnerships and providing your service like InReach into an Aboriginal organisation. So shared working arrangements. So one example of that was it was a youth service and she had Aboriginal staff. So they were getting clinical supervision from their clinical person in their organisation, but the Aboriginal worker would also work in an Aboriginal service. So many days of the week she was in the Aboriginal service. She was also receiving that kind of cultural support from that organisation. So that shared kind of support to that worker, and that service also got cultural mentoring in for that worker. So things like that. So if you're trying to get in contact with an Aboriginal service and they're not getting back to you, like all our services, we're stretched, and don't give up. Just go down to the service and introduce yourself, you know. Capable staff. Now, this is really important. How do you know your staff work well with Aboriginal people? So And what training do you provide them? What supervision, like, is there anything in your service for you to know that your staff work well with Aboriginal people? And organisational responsibility. Now, this is our biggest theme. So this is like, do you have Aboriginal staff? How did you recruit them? How do you support them? What have you got in place? Like cultural supervision, like cultural leave, and also cultural loading on your workers for mainstream service. Like, do you have one worker, two workers? Also, what training and support do you provide your Aboriginal worker, and does your Aboriginal worker have career pathways in your organisation, like not just being the Aboriginal drug and alcohol worker? Also, what training do you provide all your staff in your service to work better with Aboriginal people? Does your service have a reconciliation action plan? Do you have Aboriginal board members on your board? I said board members. So more than one Aboriginal board member on your board, and also your policies and procedures and how that reflects the work you do with Aboriginal people. So when I was going in and auditing, COVID went smack bang in the middle of audit 2 and audit 3. So it kind of impacted some of the areas of the audit for some services. Some services said, because having that networking during this time, because all services were stretched, how to keep delivering services during this time. But some services said the fact that, they was working from home and the lockdowns and stuff, this gave them an opportunity to work on areas of their, of their service in developing the cultural safety for Aboriginal people. And also changes of workers. So I went back into one service, it was a whole new team, new manager and everything. So it was then, given that service, doing the audit and then also supporting that service then too, because she didn't know what the previous worker's done. So I think that's another thing too, is documenting the work you do. So I noticed that we have from the chat thing, I noticed we got one of our lead Aboriginal auditors attending today, and who was also on the AOD, the Aboriginal AOD Expert Advisory Group, Lee Lawrence. So I'm glad to see you here. So we had 7 Aboriginal auditors that were trained to do the audits. The audit should be done by an Aboriginal person. There's a lot of self-assessment tools out there. I think it's important that Aboriginal people deliver these audits on services, because from what services say they do, and that we know the Aboriginal audit will know if that's I'm not going to use that word, but yeah, if it's sufficient. Yeah, the auditors had positive experiences completing the audits, and it also helped build relationships with the auditors, because sometimes the auditors were in an area and they never had no kind of interaction with that service before. So there was these relationships developing, which I thought was very positive. Next steps. This to be audited. You can contact myself at NADA if you would like to be audited. So yeah, so you can also find the guidelines on the NADA website, but also if you're interested in becoming an auditor, so I would, yeah, please reach out to me. Is that the last slide?
That's the last slide. Yeah, thanks, Rach.
Hey, there's me. Thank you, everyone.
Thank you so much. Thank you so much for joining us today. Thank you for your interesting presentation. It's very important to have choice with Aboriginal and Torres Strait Islander people. We don't need to be told what to do and where to go. And the fact that you're increasing that cultural competence so that we have our amazing choice that we can access services that are culturally competent. I think, yeah. great presentation. Thank you so much. I have a few questions and comments. So if we were evaluating whether something we implement results in significant change, how would we go about that? So like, how can we confidently say change was or was not significant?
Yeah, I mean, it's a great question. You know, I think, sorry, I'm just going to stop sharing because you probably don't need to see that anymore. Is that better? There we go. Yeah, that's a really great question. I mean, we did the best we could for this project. I think there's a few things that we need to think about for the next phase that we'd like to improve about how we measure change. We've used the audit scores. You know, it's a not validated tool. We were working closely with Raechel and other service providers about what clinically important change might look like. But there's improvements probably to be made there. And yeah, like as I said, it's not a validated tool. The other thing that we've talked about has been an activity to follow through and continue to improve the resources and the approach was around including client voices more strongly in developing the implementation tools as well as the outcome measures. We sort of ran this really from a service provision angle, and the whole way through we were like, how can we, include client voice more in this? But we sort of didn't have the resources for it for this project. But definitely I think that would be something that would improve how we would be able to determine what was considered success going forward for the next project. Do you want to add anything to that, Raechel?
Yeah, so in doing the audits with the service, after we completed it, it's like we had the client's voice missing from that. So it would have been really good to have a client involved in the audit with the service, because I think, or if not a client, someone from that community, like who knows the service. I think we missed that one. So in moving forward, I think that's something that should be included. With it, they will tell us.
Yeah, that's right. That's a great point. Thanks, Rach.
You mentioned patience when working with the Aboriginal organisations. As we all know, they are stretched, which is very understandable. Were there any other challenges when building the partnerships with the organisations, and how did you overcome them?
I'm not sure. There was one service that we worked with. When we went there, they were so eager to learn. Where they said, we're in an area where we know we've got a high population of Aboriginal people. We want them to access our service. So we did the first audit with them. Then we've done the workshop with them. But when I come back to audit them in 3 months' time, in that time, they've gone out and engaged with an elders group. They did a joint event together. The team leader was getting cultural supervision from an auntie from the elders group. So they really developed that relationship. And when I went back in 21 months, they just kept growing, and I was so proud of them.
That's an amazing story. That's really great to hear. Was the project advertised in local communities? How aware do you feel Aboriginal communities were of the efforts being made in these services?
I'm not sure about in communities. So, as I said, we had an Aboriginal AOD expert advisory group, but all throughout the project, I consulted with ADAN, so the Aboriginal Residential Rehab Aboriginal Residential Rehab Drug and Alcohol Network. So that's our Resi Rehabs in New South Wales. So, and also ACDAN. It was ADAN and ACDAN. I kept both groups up to date with every stage of the project, so they could oversee what I was developing in that. They made comments on the work, but as for local communities, no, I didn't get.
Yeah, it's a good question. I'm just thinking that through. Thanks, Rach. Yeah, so the services that took part, I guess they self-selected. It was an initiative driven by the primary health networks in New South Wales who were interested in doing some work in this space. So they identified or advertised the project to invite services within their networks, and that's how we identified who took part. And as Rachel's described, there was quite a thorough engagement through the Aboriginal Advisory Group, but we didn't inform communities that it was happening. But I think, as Rachel sort of described, there was a lot of discussion informally around the project. And so, yeah, I think word got out, and there was a lot of engagement from a lot of different parties over the first 12 months in particular, while the guideline was being developed by Raechel and her team.
And especially from the archer sector. So I was asked, you know, like, if we're supporting mainstream services to do work better in this space, will this impact us? Like, will they, you know, like funding is, there's not much funding in drug and alcohol. So are we making these services mainstream services more competitive for Aboriginal money? And that was never the intention of the project. Yeah, it was something that I was pulled up about, but that wasn't the intention of the project. And
no, I completely understand. Yeah. It comes back to that choice thing as well. Like, if an Aboriginal or Torres Strait Islander person wants to access another service, we're just making sure that they're giving the same cultural competency that the Aboriginal organisation's giving it also.
Yes, yeah. I got pulled up about it in the beginning of the project, yeah.
Would this project expand to a national level, broader than New South Wales?
I would love to see it broaden, but I don't feel that, you know, each state should have their own team of auditors. Like, I don't think I could go into another state and audit another state. So I think there's a lot of potential for this project.
Yeah, I mean, we've talked a lot about this, haven't we, Rach, about applicability to other locations and also to other sectors. The kind of framework that we've come up with, the broad approach, has been adapted and used in another context. But what we've sort of decided on Raechel's advice is that the actual audits need to be done carefully, and the guidelines need to be adapted and tailored based on local context. And so just rolling out this exact process is probably not the way to go, but we'd be happy to work with others who've got that cultural knowledge and local expertise to design something that's more suitable for different settings and different locations.
Yeah, sounds good. So this one says, sounds amazing, Rach and Sarah. I'm wondering what other outcomes could have been used to monitor perceived or actual change. I might have missed it, but was there also measures like comfort to access, how likely would you refer, etc.? Love your work! !
That's great. Yeah, I mean, we've picked this around a lot, haven't we, Raechel, about what other things that we could have and should have been measuring, but we weren't quite on the ball enough at the beginning. I guess we sort of were limited to short project timelines. Certainly, like you've identified out there, Kylie, some clinician measures around knowledge, attitude, and skills might have been useful to collect. We sort of collected that through qualitative interviews, but we didn't collect it in a quantitative kind of way, which I think would have been beneficial. And as we've discussed, I think that the client voice thing is really the key gap in this, where we didn't have the resource really to do that in this project. But I think the next step would certainly need to include some client reported measures as well. Rach, what else?
Yeah, when we first started talking about the evaluation of this project, for me it was really important to see if Aboriginal people stayed in the program, because they may come into the service, they may access it, and then they may not come back for many reasons. And maybe it's a service, maybe other things are going on in their life. But what I wanted to see was, you know, was Aboriginal people staying after they'd done this project? And yeah, we didn't see much change in that. So
yeah, that's right. That's what we're sort of getting at with the minimum data analysis, to see if there was, you know, if we could detect any changes in that. But unfortunately, you know, maybe for a range of reasons, or maybe they're not quite the right measures. But that was the thinking, was that if these activities around cultural competency was changing, then clients might stay in services at a higher rate than what they were prior to the project.
Thank you. So some clinicians have short time frames for completion of documentation and delivery of brief interventions. What would be your advice for services to adapt their service provision to ensure that a more trauma-informed and culturally responsive process is undertaken?
Do you want to tackle that, Rach? Or
yeah, I don't know. It's a big question.
Yeah, it is. Yeah, I mean, the time pressures is a thing that we were really aware of, I think, with designing this project, in particular, like we were in services a lot. We know how stretched services are, and then implementing this project was another thing for clinicians to tackle. There's clear links with the trauma-informed care approaches that are becoming more commonplace now, I think, between that and this as well. The balance of time is really tricky. I'm not sure how to manage that, but certainly there's more and more resources around. There's great guidance, and the guideline here that Raechel's developed with the advisory group is a really good starting point for hopefully some bigger picture activities that can be undertaken, as well as some sort of more quick activities that can be implemented to make meaningful changes. And there's, in the guideline, there's a range of resources that can link to that, even if they're just, the culturally adapted and the culturally valid service data collection resources, even just implementing those sort of tools, it's not a huge change to process, but it can help with service delivery.
Has there been any thoughts around mystery shopper style assessment of organisations? That
great suggestion.
One of the people worked on this project with us, one of the lead workers who worked with me, she so wanted to do mystery shopper and go into services, and let's see, yeah, we could. I don't think we could. Could we? No.
Yeah, look, I mean, I don't know. I haven't seen that. That's a really great suggestion. I do remember us talking about it.
And was there any consultation or participation of LGBTIQA plus mob? And if so, anything specific you can talk about?
I'm not sure. But I know ACON is also developing developed a tool, for services as well. So
that's right, Rach. I'm just trying to think. I don't think in the first phase that we've just presented today, I don't think that was part of the process, but there is work underway by ACON that we're involved in using this similar kind of process where we, set up the advisory group and identify what the key principles are. So definitely it's a watch this space thing, I think. Yeah. Great question.
And Cold also, they've developed a tool as well now, coming behind this project for their, for the services, an audit on services. So
yes, that's right. Sorry, Rach. Yes, exactly. I'm getting them mixed up. But yes, ACON and NADA are both active in this space. Yep.
Good to hear. So that's the end of our questions. We also received a few comments in the chat. So the treatment guidelines are very comprehensive and give some key indicators that services can plan against to provide a more culturally responsive and inclusive service. Thank you, everyone. Raechel, good job. I thoroughly enjoyed doing some of those audits with you. Lovely.
Lara, or is it Lee? No, Lara, Lee.
The anguish of research, hindsight, hard relate, that was a response to the outcomes that could have been used.
Yes, that's right. Yeah.
Also, how we keep this up to date. So I've been thinking of, because we did this back in 2018, so there's new resources and that coming out all the time. So I don't know how to do that. Maybe a fact sheet that could go along with the guidelines, with more up to date. I'd like to see more tools developed and also outcome measures for services for working with Aboriginal people.
Yeah, that's right. It's really I feel as though we've kind of identified the idea and the approach and the concept and shown that it's possible, but there's a range of things that we'd like to follow up on over the next phase.
Yeah. Lovely. I don't think we have any more questions or comments in the chat. Thank you so much. It's been such a great presentation. Thank you for joining us. It's been lovely to meet you all both online today.